Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you know, this is a webinar where we're going to discuss Lyme disease. And basically, you create the webinar with your questions. The way that this works in this Zoom format is I take questions that you write to me through the chat box. Now, I know that recently I'm starting to get people emailing me their questions in advance, but I want to let you know you can't shortcut the process. You got to write it in the chat box, okay? So I appreciate people thinking your questions, that's how to get the questions to me, but I want to do it in the chat box. That way everyone can read your question. The other thing I'll let you know is due to time limitations, I only have an hour and a half with you, which is a lot of time, but there's a lot to discuss, and there's no way that I can get through all the questions, although I will work through as many of those as I can. So I hope that even if I don't get to your question, there's some education and help you get through the response that I give to other questions as well too. Okay. So I am creating a recording tonight's webinar. Tomorrow morning, sometime around 9:30, 10 a.m. Central Standard Time, Austin, Texas time, I will send out an email saying that the recording is ready for you. You can watch that recording two ways. You can look at it on the webinar page at Marty Ross MD Supplements. But if you look at it there, the timestamps don't work. The only way to get the timestamps, which can take you directly to a certain place in the video, is to watch it on YouTube. And so I do, in the email, I provide you the link, the direct link to the YouTube recording as well, too. Okay? All right. I think that's it. The other thing is, I just want, so it's good to be back. As many of you know, I had to cancel last week. I haven't been with you for a couple weeks. One is my father passed away, which actually is a good thing. He was ready to go, but still quite a process. And so I went to his funeral on the 30th, and so I missed the webinar because I was tied up with that. And then one of my cousins brought in COVID. I love my cousin Tom, but about five of us got it, and I happened to have gotten it. And it's really strange to get COVID this far down the line outside the pandemic, but it still knocked me down. And I'm doing pretty good. Just if anyone wants to know, I'm doing pretty good. I'm just a little bit more fatigued than normal. Brain fog is finally lifting, which is a good thing. And so I'm ready to be back with you again here. So without any further ado, I think we'll go ahead and get started here and take the first question. And this is from Priscilla. Hi, Priscilla. Let's see. Thank you, Dr. Ross. The Powassan virus infection has my lymphatic system in overdrive and triggered onset of psoriatic arthritis. For genetic reasons, I cannot take the recommended medication PSA to quiet cytokine storm. I'm currently taking daily reishi, olive leaf, curcumin, PQQ, ATP. Is there anything else I can do to quiet down cytokines without suppressing the immune system? I'm a cancer survivor and worried about metastasis. So, so in terms of, so first of all, it looks like, so the Powassan virus, everyone, is a virus that can be transmitted by tick bites. There is not a specific pharmaceutical antiviral that has been developed to treat this virus. And so generally, when I recommend anything for people, it's to look at ways of supporting the antiviral part of the immune system, as well as using herbal antivirals, and then working to do things to quiet the cytokines. Okay. So in terms of what Priscilla's doing, the reishi mushrooms are a way of turning on the antiviral part of the immune system. Olive leaf extract is antiviral. It can kill viruses. I have not seen it tested specifically against the Powassan virus, but it has broad antiviral properties. Generally, when I'm using it as an antiviral, I like to try to start at about 500 milligrams 3 times a day. And over time, as tolerated based on Herxheimer reactions and Herxheimer response, I like to try to push that all the way up to 1,500 milligrams 3 times a day. So I just want to address that. And then in terms of the PQQ that you're on here, the PQQ is useful at stimulating mitochondria production. So mitochondria, your cell energy factories, PQQ promotes mitochondrial biogenesis and increase mitochondria mass, which may help with some of the low energy. This ATP 400 milligrams, I'm not sure what product you're on for ATP, but ATP is the cell fuel that gets generated within mitochondria. In terms of things you can do then to lower cytokines, curcumin is one thing. 500 milligrams 3 times a day is a good dose. Sometimes I will even push that up to 1,000 milligrams 3 times a day. An additional thing that you can add that complements curcumin is quercetin. Quercetin is a bioflavonoid. It's found in onions and other fruits and vegetables. It is both a mast cell stabilizer, so it stabilizes mast cells so they don't make and release as many histamines, but it also has an enzyme is an enzyme blocker that blocks the production line for cytokines, and it blocks cytokine production through a different mechanism than curcumin. So when I'm using it to control cytokines, I like to use it at 500 milligrams 3 times a day. As an example, at Marty Ross MD Supplements, we carry a product called quercetin phytosome. That's a 250 milligram pill. That's a Thorne product. I like it because I trust the quality of Thorne products. But if you're looking for a source, that's one source for it. And then finally, in addition to the curcumin and the quercetin to control cytokines, I also like working with glutathione. And the reason I like using glutathione is it works on lowering cytokines through a different mechanism. So quercetin, curcumin basically get inside white blood cells. White blood cells you can kind of think of as being the cytokine production line. Okay, it's in white blood cells where cytokines are made. All right, so that's the factory. All right, but the factory has to be given an order to make the cytokines. And what the order is that directs the factory to make cytokines is the immune system making oxidation agents in its first attempt to deal with invaders. All right. So high oxidizing agents trigger the white blood cells to make these cytokines. And what glutathione does is a very strong antioxidant. It is a number of other things too. It repairs cell injury from the inside of our cells, like nerve cells, mitochondria. It can repair mitochondria injury from the inside. But it's a very potent antioxidant. And so the way you want to take it, you need to use a liposomal variety because other varieties are not well absorbed. The product I like is a product by Research Nutritionals called Trifortify. The reason I go for the Research Nutritionals product is they've studied it, and they've actually got good studies that show increased red blood cell levels. That's what they studied was red blood cells, but increased levels of about, I think, 35 to 40%. So that's pretty impressive, actually. And so I like that product. And a teaspoon, I think, is 500 milligrams. And I usually, in acute situations, like to have people even do 1 teaspoon twice a day. If you're out of the acute situation, you can get by using a teaspoon a day. So 3 things you could do to lower cytokines: block the factory by using curcumin and quercetin. The second thing is sit outside the white blood cells, work with a good antioxidant like liposomal glutathione, and that is 500 milligrams 1 or 2 times a day. Okay, so that's the approach that I would wind up doing for that. Priscilla, are you here? And if so, did that answer your question for you?
I am here and I am so grateful. Thank you very much.
You're welcome. Good. Does
Uh,
anyone else have any follow-up question there at all? Or Priscilla, did you have follow-up on that?
uh, no, it's just that I'm not going to take the methotrexate. I think it's a big mistake.
Yeah.
And that's the medication for psoriatic arthritis.
Right, right. An immune regulator, if you will, or an immune suppressor. So I would agree, probably not a good idea.
Thank you very much
All right,
for that validation. That was the conclusion I had come up with.
great. Good.
I'm
Good
very
luck to you.
grateful. I'm going to change my protocol, and um, I will check in if needed. Um,
Okay, very, very good. Very good.
thank you.
Does anyone have any follow-up questions to what Priscilla and I were talking about? N Not a new question, but a follow-up question. Okay, I want to be clear about that.
Yes, I do.
Yeah, Jonathan.
My integrative doctor has me taking NAC, and he says it's a precursor to glutathione, so I'm not
Yeah.
taking glutathione. Is that okay?
All right. Yeah, you can use that. What I have found, so NAC is N-acetylcysteine, NAC is a building block that the cells will use to make glutathione. So that's one way to raise your glutathione levels. The other is just give glutathione. In clinical terms, I have found, and I've worked with both in my practice, I find that giving the glutathione is stronger. It has a more rapid effect and seems to have a better effect. However, it's more expensive. And sometimes from a wallet standpoint, NAC is a little bit easier to handle. The other thing is there's an occasional person that will react to the glutathione because they have difficulty handling sulfites, I believe. And the NAC does not have that problem. So if I've got somebody that's reactive to glutathione, I might switch over to the NAC. A dose I like to use in terms of building glutathione with the NAC is 500 milligrams twice a day. Any other follow-up questions there? All right, let's move on here. Thanks, Priscilla. Good luck to you. Hello, Eric. Let's see. How do you approach handling root canals in chronic Lyme patients? When do you recommend a Lyme patient do when they have a 20-year-old root canal and weird mild pain when chewing in that area that started after COVID infection? But cone beam CT imaging and x-rays aren't showing a problem. Thanks as always, and glad you are feeling better. Thank you. So, Eric, the one thing I like to do in situations like this, and I'm not sure if your dentist falls in this category or not, but the one thing you're worried about with previous root canals is that there's pockets that can develop under the root that can be harbor infection, including can harbor Lyme. And so it can be a pocket of Lyme infection. Um, so a skilled dentist, a dentist that knows to look for this, often can see those little pockets. And the type of dentist that usually has the skill to do this, they were called biologic dentists. They're not your standard dentist. So if you're working with a biologic dentist and they're not seeing anything there, it maybe there's not. In these situations, though, there's two options. One is if they do see a pocket under there, sometimes they can inject ozone directly into it. Now, many of you know I'm not a big believer in doing IV ozone or rectal ozone as a germ killer because generally what happens in that situation is it gets absorbed in the blood and your blood is so full of antioxidants they get rid of the oxidation killing effect of ozone. Okay, there's test tube studies that show that if you put germs in a test tube, put ozone in it, the ozone will kill all the germs. If you put a small drop of blood in there, in that test tube, there's no germ killing at all because in the bloodstream, which is where we ultimately try to get ozone when we treat Lyme, some practitioners do it. All of that killing effect of the ozone gets wiped out. So, as many of you know, I am not a supporter of doing IV ozone, rectal ozone to kill Lyme. I think you're throwing your money away. Okay. But in terms of using ozone in a space where you inject the ozone right into the pocket where the infection is, where there's no blood necessarily that's going to have antioxidant in it that are going to get rid of that killing effect, I think it can be effective. Okay. So that's one thing. If they could see a pocket in order to save the tooth, I might suggest you follow through with doing ozone injections into that area. However, if they're not seeing an infection and that tooth is bothering you and it is in the area of an old root canal, I would think about pulling it. And I mean, I'm not a dentist, okay, but what I can tell you is I have seen enough, and I hope you talk to your own doctor about this as well too, right? But generally, I have found that you can have, I would call it microscopic infections that are not showing up in all their imaging. And I have seen enough people that have improved results after a tooth like that comes out to suggest that removing it is an option to consider. Okay, I hope you understand why I'm saying that. Because if it is an infection, the only way to do is get rid of that space, pull the tooth out, and then you get healing in of that space, basically. Okay. All right. Does anyone have a follow-up to that at all?
I just have a quick question about the last thing.
Sure.
Does NAC, can it irritate esophagitis or gastritis?
Um, so there's a rule of medicine I have, which is anything can happen to anyone with anything. Okay. So I can't say never, but what I can tell you is I haven't seen it happen. I haven't seen anyone that has had gastritis, heartburn, esophagitis issues that got exacerbated using NAC. So I'd put it, um, nothing's impossible, but I would put it low down on the list of possible side effects from it.
Thanks.
All right. Good luck to you, Missy. All right. All right. Let's move on here. Hello, Tanya. Let's see. Hello from Europe, Dr. Russ. Well, hello, and I'm glad to see you're awake still. That's a little bit of a time difference here. I have two questions. I have been on the Cowden Protocol for almost 8 months now. I'm observing that each time I take Samento, my symptoms worsen. I start to feel down. My sleep gets really terrible. I get sometimes very anxious and stressed about stuff. When I am on Banderol, all this goes away and I feel so much better. I even feel I can start working again part-time when I'm on Banderol. Not so on Samento. As I switch every 2 weeks, it's a roller coaster. My doctor says this means that Samento is more effective than Banderol. What's your view? Do you have any comments or suggestions? Second part, I read that Samento only addresses the spirochete and that in order to address the cyst, one should also take grapefruit seed extract. Is that your opinion as well? Shall I ask my doctor to include grapefruit seed extract? I also take serrapeptase and lauricidin for the biofilm. All right. So everyone, there's a Cowden protocol, which has specific herbs that you rotate. I think it's on an every 2 to 4 week basis. And the herbs are intended to kill Lyme and Bartonella. The protocol is a little bit weak on the Babesia side, although I understand it may have been updated to include Cryptolepis, which was not part of the original protocol. Okay. In terms of Samento, Samento is cat's claw. It's a brand. It's made by a company called Nutramedix. It is a TOA free form of cat's claw versus the Montana pharmacy product I carry at Marty Ross MD Supplements has TOA. I think the TOA is a better version. You can read people on both sides of the issue on that. Okay. So in terms of what cat's claw can do, studies tell us that cat's claw, generic cat's claw, is useful at treating growing and hibernating forms of Lyme. Okay. And I'm sorry, growing and hibernating states. So Lyme has growth states, Lyme has forms. All right. Let me try to address that. So all of the forms can either be growing or hibernating. All right. Studies suggest maybe 5 to 10% go into hibernation. We, as of a number of years ago, we discovered these hibernators and we started thinking these hibernator persisters could be why people don't get better. Standard prescription antibiotics often are not good against the hibernators. What more recent studies tell us, and these came out about 2 or 3 years ago at a Hopkins University, Johns Hopkins, is that cat's claw is one of those agents that actually can treat persisters. Okay. And then what we observe based on Petri dish experiments that were conducted, gosh, this might even be about 10 years ago, using Samento by a researcher out of New Haven, Connecticut. Her lab showed on Petri dish that the Samento can go after both go after spirochete and cyst Lyme. So let's talk about what those words mean. All right. So I've already said you can have the growth states, but then there are forms to the germ, okay? And the forms to the germ are that there's something called a spirochete that looks like a corkscrew. There is a microscopic form of the germ called a cyst. It's a microscopic cyst. And then the germ can actually lose its covering and go inside of cells, and we call that the L form or the intracellular form. All right. We think on the Petri dish experiments, Samento clearly did kill cysts, clearly did kill spirochete. We had no way of looking inside the cells. What I can tell you from clinical experience is I do think that it must get at intracellular Lyme as well too, because it used to be that my main herbal protocol for treating Borrelia Lyme was to use a combination of Otoba, which is what Banderol is, and cat's claw, and I got a lot of people well just doing those two things together. Okay. The other thing that Eva Shoppy and her New Haven lab showed is that the combination or that cat's claw Samento and Otoba Banderol, those two specific products, were good in the lab at breaking down biofilm, slime layers that cover the germ. And when you use the two together, there was a synergistic effect where they seemed to even get a whopping kill of both breakdown of the biofilm and killing of germs that the combined, you wouldn't expect if you added up their effect, but when you put the two together, they help each other in some way. Okay. So cat's claw is good. And Otoba is good. Samento again is a TOA free version of cat's claw. There are some people that say that's better. Buhner, when he was still alive, said the TOA version was actually better. So not the Banderol or not the Samento, but other companies' versions of cat's claw. As I've read on the debate, I think I could go either way on that one. Okay. Now, in terms of why are you getting knocked down more with one? So it is possible, as your doctor is suggesting, that it is possible that the Samento in you is more powerful. Okay. And so you may be getting a better killing effect. So a killing effect is something called a Herxheimer reaction. And what happens in a Herxheimer reaction, to help you decide if it is a Herxheimer reaction, we have to understand what a Herxheimer reaction is. Okay. So when you are sick with tick-borne infections, the major reason you feel bad is that your white blood cells, in trying to get rid of those infections, overproduce cytokines. We were talking about cytokines earlier in the discussion of Powassan virus. So cytokines are good and bad. When your white blood cells see an infection, it triggers them to make cytokines. They make cytokines because on a right amount and a good amount, they're designed to turn white blood cells on to fight the infection better. They cause more white blood cells to be made, and they draw those white blood cells to where the infection is, okay? But in some conditions, they get overly turned on, like in COVID, like in chronic virus infections, like in tick-borne illnesses. And when you get excess cytokines, those excess cytokines give you mostly what we call Lyme symptoms or COVID symptoms, which is brain fog, fatigue, you're hurt all over, pain in the joints, your sleep gets disturbed, etc. Okay, so all those symptoms that we call Lyme symptoms, COVID symptoms, too many yeast living in your intestine symptoms, the majority of those are due to excess cytokines. So in helping to determine then when you react to a medication, is it a Herx reaction or is it a side effect issue? You have to look at your underlying symptoms. If it's a Herx reaction, the underlying symptoms you have as part of your Lyme disease should get worse. It shouldn't produce new symptoms, okay? If, though, you're on Samento and how you feel bad is a different set of symptoms than your underlying symptoms, it's probably a side effect, okay? So I would have you consider that as you're trying to decide what to do with that Samento or not, okay? All right. So in terms of grapefruit seed extract, I don't think you need it. I think if you're using that combination of Banderol, Samento, you should have spirochetes. You have all the forms covered that way too, okay? All right. So Tanya, did that answer all your questions for you?
Yes, Dr. Ross, thank you very much.
All right. Good luck to you.
Thanks.
Does anyone have any follow-up comments there or follow-up questions? All right, let's move on here. Hello, Bill. Let's see. Glad you're feeling better. I am too. Believe me. Let's see. I've been on herbal regimen for about 3.5 months. I'm considering going to an antibiotic regimen of mino, rifampin, clarithromycin, and atovaqone. I'm really concerned about the long-term effects these medications will have on my body using for a long time. When you have seen people use these, what percentage of people have long-lasting negative effects on their body? Is all the news about methylene blue helping energy legit? Thanks. Let me start at methylene blue. The answer is yes, it is legit. So methylene blue, many of you may be familiar with, we are using as an antibiotic in Lyme disease because it's been shown to be helpful against growing and persister Bartonella. It's been shown to be helpful against persister Borrelia. We also think it does go after growing Borrelia as well too. All right. So methylene blue, many of you may be familiar with, is actually it's a drug we've repurposed to use in Lyme disease. It is designed actually to help people with a condition called methemoglobinemia, where their hemoglobin inside their red blood cells doesn't release oxygen easily when they're in stress situations, and so their tissues become starved of oxygen. Methylene blue basically bumps the oxygen off of the hemoglobin And it's mainly, historically, has been used more in urgent situations on a one-time basis in the ER, given IV to free up their oxygen, okay? But it has been observed to be a good germ killer. We're not 100% sure how it works in terms of germ killing. The thought is, though, is that it somehow gets into the membrane of growing and non-growing germs and destabilizes the membrane, the covering of the germ, so the germ falls apart. Okay? That's how we think it works. All right. Now, the other property that methylene blue has is it can carry electrons. And in its role in generating energy and helping energy is to carry electrons within the mitochondria. And so there is part of generating energy in a mitochondria involves a process of creating this chemical called ATP. What drives ATP, which is your main energy chemical, is it is produced through a bunch of chemical reactions that involve carrying electrons from one reaction to another to another. And that takes place in something called the electron transport chain. Okay. So sometimes the electron transport chain gets damaged. And so you can't have movement of electrons. And what methylene blue does is it steps in and it carries the electrons from the parts that are damaged over to the undamaged part and effectively acts as a bridge. It doesn't fix the underlying damage, but it does bridge and carries the electrons. So it is very useful at generating energy. I've seen some big energy changes in people using that, and my Lyme and my Bartonella patients. Where it's also gotten some notoriety is in helping treat Alzheimer's disease, because one of the things that happens in Alzheimer's is you can have blockage of this electron chain transport chain as well too. So can it help energy? Yes, it is legit to do that. Okay. All right. All right. Then in terms of the antibiotic protocol you're looking at here, the minocycline, rifampin, clarithromycin, atovaqone, every one of these antibiotics has a unique set of side effects that are unique to them. But generally, these side effects go away within a certain time frame after you stop the antimicrobial. So, for instance, minocycline sometimes gives headaches, sometimes causes easy burning. Okay, rifampin can cause liver inflammation. Rifampin has a side effect list that is a gazillion miles long. That would scare you you'll be scared when you read it. The reality is, I've only had to stop rifampin due to side effects about 5% of the time in my practice. Okay, but any of those side effects again go away once you stop the medicine. Clarithromycin, the most common side effect would be nausea and diarrhea. And then atovaqone is a very fat soluble medicine that we use to kill bloodborne parasites, in this case, Babesia. And because it's so fat soluble, it can concentrate around the nerves in your brain. And sometimes it can lead to headaches, and sometimes it can give depression, and sometimes it can cause anxiety. Okay, so I just want to make you aware of it. Now, because it is so fat soluble, it can sometimes take 2 to 4 weeks after stopping the atovaqone for those side effects to go away. All right, okay. Now, the one thing I want to make you aware of, rifampin is useful for Bartonella. It also can be useful for Borrelia treating spirochete and cyst. There is an interaction problem between rifampin and atovaqone where the rifampin will lower effective levels of the atovaqone. So you need to be aware of that, and your provider may need to go a little higher dose on the atovaqone. It didn't stop me from using the two drugs together, but just be aware of that, okay? And then so short term, yeah, you may have some side effects. Most of those, they will all reverse, okay? The area that you need to be aware of, though, is when you're comparing herbal antibiotics versus prescription antibiotics, your prescription antibiotics have a greater potential of harming and disrupting the healthy intestinal microbiome. Okay. And so your intestinal microbiome, we now are starting to understand, is the brain behind your nervous system, is the brain behind your immune system, is the brain behind your heart, is the brain behind every organ system in the body. And so doing things that are not harmful is a good idea. So because of all this new science we're getting on the benefit of the microbiome, I tend to suggest that people try herbal antibiotics first because they have less disruptive potential. But there are times when you need to do prescriptions, all right? And so during that, then the best thing you can do is try to take steps to protect your microbiome. And so there's a whole article I've written about that. I'll show you that here in a minute. But basically, you want to be on a good probiotic, and the choice of the probiotic depends on what's going on in your gut. If you don't have any gut symptoms, I would suggest using a spore-based probiotic like a core biotic by Research Nutritionals, and I would do a couple pills 1 time a day. If, however, you've got symptoms of leaky gut going on, then my preference, meaning cramping, gassiness, bloating, then my preference is to use a product that has Akkermansia in it, as well as other agents in it that will produce butyrate to heal your leaky gut. And the product that has all of those in it is a product recommended by or manufactured by Pendulum, which is called Metabolic Daily. And I like to have people take 1 or 2 pills of that 1 time a day. The other things you need to do to protect your gut is to make sure you're getting enough prebiotic starch fiber that feeds good bacteria and that you're getting enough polyphenols. All right. So both of those you can get through your diet if you happen to have a diet that's mainly plant forward and you eat a variety of fruits, vegetables, and even beans and legumes. All right. But if you can't do that, if you're not a person that can do that kind of diet, then you should supplement polyphenols. And the way to supplement polyphenols is to take a polyphenol pill. And the product I like for that is a product made by Pendulum, which is called Polyphenol Booster. Its main source of polyphenols is pomegranate, and I would do a couple pills 1 time a day. And then, in addition, for a prebiotic, the product I like for that is a product called Mega Pre, Megapre, and that is full of various starches that are useful food sources for your good bacteria. Okay, all right. So I'll show you the whole article here in a minute, but those are my comments there. Bill, do you have any follow-up questions there?
Dr. Ross, great information. Thank you. One other question to add to this. Would you add artesunate into that? Am I pronouncing that right?
You know, before I would use artesunate, I would actually do cryptolepis. So artesunate, artemisinin, and you can get artesunate actually, I believe, as a prescription in some countries. I don't think so here in the US. Or you could do the herbal variety of it, which is artemisinin. To be honest with you, I find better benefit using cryptolepis if I want to go in herbal to add to something like that.
Great. Thank you.
All right. Does anyone else have any follow-up questions to what Bill and I were just talking about?
Do you ever see mast cell and histamine stuff getting worse with the long-term use of those drugs?
Yeah, a good question. I'm not sure. So, um, mast cell syndrome, mast cell activation syndrome, everyone, is a condition that can occur in people with chronic tick-borne infection. So your mast cells are your allergy cells. And it used to be that we thought that the only thing they ever got activated on was because you had a pollen or a cat dander or a dog dander that landed on them, triggering them to make histamines. What we now know is chronic infections and mold toxins turn on your mast cells too. Okay. And not only do they produce histamines and you get all these extra histamine reactions that we call mast cell activation syndrome, but they become big producers of cytokines as well too. All right. So Eric, the question becomes when people develop mast cell activation on medicines, is it a progression of the underlying infections overly triggering those mast cells, or because those mast cells may already be turned on, are people sensitized to then start gaining reaction to medications that we give? Okay. What I can tell you is I haven't seen in using a minocycline, rifampin, clarithromycin, atovaqone any greater tendency of people to develop mast cell activation syndrome than in people that I do herbal antibiotics with, for instance. Okay.
Thank you so much.
You're welcome. Let me just do, I'm going to do a quick screen share here. Let's see what we can get here. Okay. So this is my store, my information site and store. As you know, I brought both of these together. Again, for those of you who haven't been here in a while, if you just click this Lymeology guide, you'll see the whole menu display that has all of my helpful articles on how to manage tick-borne infections. Okay. And then what I have done within each of the supplements, we have the whole menu here too. But if you go to one of my, the reason I did this was to try to integrate my information a little bit better. So for instance, let me see here. So Algonaut is the manufacturer of Neuroprotect, which is one of the products that I like to use for mast cell activation. It stabilizes your mast cells, okay? And one of the things I have done on every one of these product pages now is I've integrated in education. So if you were to click on this Lymeology guides on any of my product section, you'll see that I've linked it back to education articles I have about showing how this product may have additional benefits or how this product may even work, okay? So I wanted to integrate the education with my product pages here. All right, now I will admit we've had difficulty with my store. My developers have not produced the best site, but we're getting there. And it's now finally gotten to be a faster site, much faster, and we're still working through some of the glitches. So for those of you that have faced glitches here, I apologize. We are working through it, okay? All right, so then the thing I wanted to show you is my, let's see, microbiome. So this is my article called Your Guide to a Healthy Intestinal Microbiome, even on antibiotics, okay? And it can be a little bit of a long article, I will admit, but if you read through here, I go through the steps you should take to protect your gut, including a discussion of prebiotics as well as polyphenols, etc., and how you choose which, it helps you decide which probiotic product you would choose, okay? And then for those of you that are looking for information about mast cell activation, this is my mast cell activation article. I walk you through the key steps to figure out if you might have it, as well as the different things you can do to deal with mast cell activation. Okay. All right. Good luck to you, Bill. All right. Hello, Elizabeth. Let's see. Bart with increasing symptoms over last month. Underinformed LLMD put me on azithromycin only 5 months ago. I requested fluconazole ad on 2 months ago. She instead added Bactrim, not aware of any response. Methylene Blue 50 milligrams twice a day for 6 months. Doing clove and oregano oil as had 2 bottles, and need to switch to your cinnamon clove oregano blend. Just started Japanese knotweed. I took the tick immunocombo TID for a long time and wonder if my body's not using crypto as a defense because system not naive. So Elizabeth, I'm questioning. So you gave me a lot of background here. What's your question?
And there's a couple of more parts because I had to be in parts. So a couple of more pieces below.
Oh, here we go. Okay.
Yeah.
I see. Okay. Let's see. 3 days ago, my vision, which was always been fine, shifted to significantly impaired, close-up vision, car lights, radiating a halo effect, very discouraging, significant problematic brain fog, take Memory Pro, foot cramps only barely managed with 3 times a day dosing potassium, endothelial glycocalyx, bulging veins, shoulder, taking arterisol, skin collagen breakdown somewhat improved, taking the Thorn product per U plus additional amounts of BPC 157, twitchy flesh, hip, ankle, not uncomfortable. And real fasting seems like an option is already an fasting. Desperately need an informed LLD derivable from Philly area. Is that your question then?
Yes.
Oh, all right.
That's
Boy, so my okay, just a couple thoughts here. So and if I had time to actually dissect this with you, I would. We not in this forum, I can't. But if you've had a big decline and you're also been doing a lot of things and you're going nowhere, consider if you might have developed too many yeast in your intestines. Okay. I don't know if you remember earlier, I said that the main reason you feel bad in these illnesses is cytokine excess. And one of the big things that can happen, especially after you've been treated for a while, is even on herbal antibiotics, you can develop too many yeast in your intestines. And too many yeast in the intestines trigger excess cytokines. One of the things I found in my practice clinically when I was working with people, if they had been doing fairly well and suddenly they had a big downturn, if I went looking and kicking around to figure out if they might have too many yeast in the intestines, about 80 to 90% of the time I would discover they did, just based on clinical questions. And if they did, if I devoted part of my treatment to killing yeast, usually within 30 to 60 days, most people would get back to their baseline. It can be huge what intestinal yeast can do, okay? And the thing that tipped me off to wonder about that is you've had all this decline in your vision now too, all right? So the things to make you wonder if you have too many yeast are, have you been on herbal or prescription antibiotics for a while? The answer is yes. Okay. Number two, do you have increased sugar cravings? Number three, if you do happen to have sugar, even though you may not plan on it, but you have sugar, do you feel a lot worse for it? Number four, any intestinal gasiness and bloating. Number five, any vaginal itching, vaginal discharge. And number six, any worsening skin problems. Skin issues tend to get worse whenever you have intestinal yeast. Okay. So if you have yes to a number of those, look at yeast. That's just one thing to think about.
Okay.
All right. All
Yeah,
right.
it doesn't seem like it, but
Okay. Okay. And then in terms of who's in Philadelphia area right now, the last doctor that I knew that was in Philadelphia was Anne. God, I'm blanking on her last name, but she closed her practice. She's not in Philadelphia anymore.
yeah.
So I'm just not sure
can
who
be
to
New
rec-
Jersey, can be, any surrounding areas, but yeah, never mind then.
The closest that I would, if you're going to look in that area, you might even look over in Red Hook,
Mhm.
New York. There's two brothers that practice in New York. One is up in the Rhinebeck area, and one is down, I believe, in Red Hook. And it's the Bach brothers, B-O-C. And I
Right.
believe it's Stephen Bach and God, what's the other one? Anyhow, one of the Bach brothers is, I believe, in Red Hook, and he practices. I would say he's integrative like I am. He's not identical, but he practices in a similar fashion to what I
Right.
do. Okay.
Okay. But what about, I I don't feel like I'm getting much action
Yeah, because you're on so many
from what I'm
things.
taking.
with
Is there
breast-
anything more I can do for biofilms? You said no lumbrokinase. Sorry. You said no
So-
lumbrokinase because of my skin. Yeah.
Yeah. So here's the thing. You are on so many things already.
Yeah.
I would need to literally spend a visit with you teasing out what did what and what's helped and what hasn't helped you to come up with a plan. And I can't do that quickly off the top of my head here for
Okay.
you.
Okay.
All right. All right.
Thank you.
Good luck to you. All right. All right. Does anyone have a recommendation for Elizabeth in that area of the country?
The last name is Corson. I can put some New Jersey providers in the chat too.
Okay. It was Ann
Right.
Corsons. Thank you. Thanks for reminding me, Eric.
I'm in this area, so I know all of them.
All
Oh,
right.
thank you.
Good. So Eric and Elizabeth, you might even, if you feel comfortable, exchange contact information within the chat. Otherwise, just share names back and forth through the chat. Okay.
Right.
All right.
Thank you.
Yeah. Thank you, Eric.
No problem.
David says hello from Chico. Hello back to Chico. And you too, David. All right. Hey, Dr. Ross, I'm currently being treated for chronic Lyme and Bartonella. I'm on methylene blue 50 milligrams twice a day, was titrated up from 15 milligrams for 1 month and 30 milligrams for a month, and just started 50 milligrams this week. Clotrimazole 10 milligrams 3 times a day. I'm also taking liposomal cinnamon, oregano, and clove oil twice a day. The herbals I'm taking are, hold on, here's a minute. I'm also taking cinnamon clove. Okay, got it. The herbals I'm taking are Hutania, Otoba, cat's claw, working up to 30 drops twice a day. I do take supportive supplements like probiotics, liposomal glutathione, pectazole, fish oil. Is there anything I'm missing? How long should I see improvement? Okay, so let me make just some comments here. So methylene blue, I think, has been a game changer for many with Bartonella. It's very good at treating growing and persister Bart. And the laboratory studies out of Hopkins also indicate that it can break down biofilm. Okay. It also, as I've said earlier, can be useful against growing and persister Borrelia as well too. All right. All right. Clotrimazole is, I understand your provider is using it. It's not what I would do. And let me explain why. So in the Johns Hopkins experiments, they did show that they did a study where they tried to take a representative of each antimicrobial class, like they used doxycycline in their study, not minocycline. And for the azoles, which clotrimazole, fluconazole, itraconazole are all azoles, they used clotrimazole in their experiment. And in their petri dish experiments, clotrimazole was really effective at killing growing and persister Bartonella, all right, in the laboratory, okay? The problem is clotrimazole is just horribly absorbed out of the gut. And what people were doing initially based on that study is they were preparing, they would have compounding pharmacists prepare a liposomal variety of clotrimazole in the hopes that the liposomal variety be well absorbed. What I will let you know is we have no studies showing that it is, okay? Um, I have not, I don't like using clotrimazole because I don't think it's well absorbed, all right, even in a liposomal form. And so what I use fluconazole instead. And it's because it's a member of the family. And I have seen really good clinical results using fluconazole, all right? So you might want to talk with your provider and see, can they switch you over to fluconazole, 200 milligrams one time a day? I found much better clinical reaction response using it over clotrimazole. And again, the clotrimazole issue is I don't care if they make it liposomal. I don't think it's well absorbed. Okay. The data suggests it's just not well absorbed. And no one has done studies looking at liposomal to see if it is absorbed. All right. So I would get away from the clotrimazole. I would look at probably doing fluconazole. All right. If you look at that combination in a methylene blue, fluconazole, which is what I would suggest here, and taking the cinnamon clove oregano, those three things together are really effective at both Borrelia and Bartonella. So on the cinnamon clove oregano is good at breaking up biofilm. That can block your treatment for both of those. It's really good at treating growing and persister Bartonella and Borrelia. The using fluconazole as a substitute for clotrimazole is very effective against Bartonella. In addition, it has anti-cyst properties at treating Borrelia as well too. And then the methylene blue is good for Borrelia. So I think just those three things would be what you need. I would probably unload your system and stop the Hootenea, Otoba, and cat's claw. All right. Now I know they're herbal antibiotics, but all of these things put pressure on your good microbiome, and I'm for limiting to the most essential things when I design treatments for people. Okay. All right. Then, in terms of some things that are missing in this, I would get stronger at addressing two things, and you can do this with one supplement. And that is, we think one of the big reasons that Bartonella treatments get blocked, there's two reasons. One is something called germ fibrin nest or Bartonella fibrin nest. And the second thing is biofilm, slime layer that covers the germs, okay? Now, biofilms are made up of a sugar slime layer held together in a protein skeleton, which is made up of fibrin, your blood clotting protein, all right? Fibrin nest are basically the Bartonella basically gets wrapped up in fibrin and gets stuck on your blood vessel walls. It's different than being covered by a biofilm. Okay, they're two separate things, all right? But you can take lumbrokinase, which is a group of enzymes that are made by earthworms. It has a strong fibrinolytic capability, meaning its ability to break down fibrin. So it breaks down fibrin that hold your biofilms together, and it breaks down fibrin that wrap themselves around your germs. And that can be kind of a game changer in people's treatments, okay? And so I would look at doing lumbrokinase. At this point, there are two products I carry in my store. One is a product by Canada RNA called Maluki. That's a 20 milligram pill. Allergy Research makes a product that's a 16 milligram pill. And both of those, I would start at one pill a day And as you tolerate it, I would go up to 1 pill twice a day. The thing about lumbar kinase is you want to take it on an empty stomach, because if you have it with medicines or food, it's going to act as a digestive enzyme and be all used up being a digestive enzyme, and it will not get absorbed to break down your biofilms. And so what that looks like is do not stop all medicines and food, anything, supplements, 1 hour before you take your lumbar kinase, and then you can resume them again 1 hour later. Okay. All right. So that would be one thing I would add into this. The other thing, yeah, I think that would be the main thing I would do. I would look at seeing a provider to flip out that clotrimazole, and I would look at adding in lumbar kinase. I think those could make some good differences for you.
Awesome.
John, do you have any questions?
So I forgot to put it on. I am taking a lumbar kinase, and I am at 1 pill. I use the allergy research group one.
Yeah.
I'm taking 1 pill. And my practitioner did put me on fluconazole when I first started. So I've been seeing her for about 5 months. And when I initially saw her, what we did is I did 2 months on the Cowden. She put me on fluconazole, and she wanted to see how I'd react before she put me on the methylene blue.
Yeah.
And that's why she titrated me up. So I'm not sure why she wanted me to go to clotrimazole.
Yeah.
But
she may have been thinking if she was concerned you were on fluconazole for a while, she could be concerned of resistance. What I
Okay.
would do instead of, if she's concerned about resistance, that's why she stopped the fluconazole. And instead of clotrimazole, then I would have gone to itraconazole,
Got it.
which is well absorbed, and also I have good benefits in Bartonella for that. It's the same family, but it is it was designed to be absorbed. Okay, clotrimazole was designed to be a topical agent on your skin. It wasn't designed to be absorbed.
She has me on the lozenges. I don't know if that makes a difference either.
It's still, even if it gets, she's hoping that it's going to be absorbed through your mouth into the bloodstream, but there's no data that shows that.
Got it. Okay. Thank you very much. I really appreciate it.
All right. Yeah. Good luck to you, John. All right. Anyone have any other follow-up questions of what John and I were talking about?
I do.
Yeah.
Can you please comment, Dr. Ross, on the difference between taking an oral methylene blue or the pharmaceutical grade, the 99% pharmaceutical grade? I take 5 drops in some 4 ounces of cranberry juice, and I get out in the sun after about 15 minutes of taking it for 20 minutes, as long as it's before 10 and after 4.
Right.
So what's the difference?
So I want to make sure I understand. Are you taking something that's made by a compounding pharmacist, or is this something you found on the internet?
No, it's something my integrative doctor prescribed. It's the drops. It's the methylene blue drops. It's 99% pharmaceutical grade, and I just got it on Amazon, but he told me which one to get. And I take the drops.
Okay. So here's my only issue. Okay. So I haven't looked at the company that he's having you buy it from, but if it's sold online, it is not approved as a pharmaceutical. Because that's the only way they can sell it to you online. The only way you can sell something, anything that is pharmaceutical technically needs a prescription. Okay. Now, I know they're saying pharmaceutical grade, and so, because keep in mind, methylene blue is a dye. It's a clothing dye, right? And so there are some companies out there that are using methylene blue that's designed for clothing dye. They turn it into drops, and they call it pharmacy grade because they are supposed to have certificates that validate its purity. Because the problem with taking clothing dye methylene blue is that it may have heavy metal impurities in it. Okay, so that's my main caution. Maybe your doctor actually talked to the manufacturer. Maybe they have certificates from that manufacturer, but that would be my only concern about that. Okay, but if it truly is pharmacy grade, it doesn't matter whether it's drops or it's in a capsule. They're gonna methylene blue is very fat soluble and very well absorbed out of the gut. I know there are some companies, compounding pharmacists, that want to turn it into a liposomal product, That's garbage. They don't need to do that because the studies about methylene blue and stomach absorption are really suggest great absorption. In fact, it easily crosses the blood-brain barrier as well too. Okay, so if you know, so pharmacy grade, whether it's made by a compounding pharmacist or what you're getting is truly pharmacy grade, whether it's drop or capsule, doesn't matter. They're both really absorb great. Okay.
Thank you.
You're
Dr. Ross,
welcome.
one last thing. You never answered the second part of about how long should I expect to see improvement? Um, uh,
Oh,
the only reason why I'm
yeah.
asking that is just because the past week,
Right.
since I started the 50 milligrams, I've had a little bit more brain fog and
Yeah.
fatigue. And I'm thinking that's just killing it. So I'm happy, but
Yeah, it could be Herx reaction. So typically, if general rule of thumb, if you are on a Bartonella prescription program that is working within about 2 to 3 months, you should start seeing improvements. Okay. So that's just a general rule of thumb. So give it a little bit of time. I'm actually encouraged if you've got some worsening, it may mean a Herxheimer reaction, meaning it's actually killing something.
and that's what I figured, especially because like I said, I bumped up to 50 from
Yeah.
30 and I started feeling that. So I'm like, oh, okay, this might be working now.
Right. Good luck, John. All right, let's move on here. Hello, Brittany. Let's see. What would you suggest for patients that are having difficulty treating due to severe psych herxing, even when microdosing herbs? I understand cytokines, inflammation, and currently using glutathione and curcumin, not as strictly as I should due to finances, and Buhner supporting herbs. My LMD prescribed azithromycin, and it took me a couple months to get 250 milligrams. I've been afraid to try rifampin, so started herbs hoping that would be gentler, but I'm not finding that to be the case. Suggestions. Can microdosing herbs or even prescription antibiotics ever be effective for Bartonella after decades of infection and psych symptoms? Okay. So one of the absolute sickest patients I ever saw was a Canadian patient of mine that had been I think mishandled by a previous prescriber that had set her into such a bad Herx reaction that by the time I saw her, she reacted to everything at small doses. Okay, she had both Bartonella and Borrelia, and eventually the way we got her well was using drops that her body can handle. And we initially started at I think it was about a quarter drop or half a drop once a day of Hutania and Sida acuta, which is what I was using back then for Bartonella, and Cat's Claw and Otoba for Borrelia. And in the end, the best we could get her up to was 2 drops twice a day of all 4 of those herbs. And we increased the dose based on her Herx reaction. Okay. And unfortunately, what happened to her is I think what I find is when people tend to have a lot of reactivity, some of that is mast cell activation, but some of it is they're people that genetically, I think, have trouble detoxing. Okay. The reason I raise that detox issue with you is what determines whether you're going to get well is do you have enough blood level of your herbal or prescription antibiotic to kill germs? All right. And what determines that blood level is how much do you take and how well can your body clean it out? If you have impaired detox mechanisms, you don't need to take as much to get adequate blood level. All right. So in her situation, I got her 100% well. It took a year and a half, and we did it at only 2 drops twice a day of those 4 herbs. All right. All right. So the reason I raised the detox issue is it could be, even though it may sound like a small amount, it may actually be a lot in her blood because she couldn't clear it out. And that may be what's happening with you. Okay, so keep that in mind. So can you get well with herbal antibiotics? Absolutely. Can you get well with small doses? Absolutely. You can. Okay. All right. So I want you to know that. Okay. Second thing is for mental health herxing and mental health issues, the best thing you can do and the trouble is there's a cost factor, but IV glutathione may be a better way to go than oral glutathione. If you are going to do oral glutathione, make sure it's a liposomal variety. And if you're not using that trifortified product I talked about, give it a try because it's got the science that says it's absorbed, okay? But the other option would be the better option, and I have used this in my practice before for people that were having psych herxes, is IV glutathione can do a good job at turning a person around. And you can give it as often as twice a week. Sometimes once you build up your stores of glutathione by doing twice a week, you can back down to once a week or once every 2 weeks, and that can be enough to maintain a person as well too. Okay. Yeah, Brittany, did you have any other questions there?
Nope, I think that's great. Thank you. I appreciate it.
You're welcome. Good luck to you.
Thanks.
Did anyone else have any further follow-ups there? Lori?
Well, yes, I do. But it was the question before
Okay.
about Methylene Blue.
Yeah.
What do you think of the transcription version by Dr. Scott? What are your thoughts on his the quality of his product? They're like little Trojans, I guess, when you suck on.
I don't know the product. I know that what I use for my methylene blue is I prescribe there's 2 different compounding pharmacies that I use. One is a pharmacy in Florida called InfuServe. They're out of St. Petersburg. And then there is a pharmacy in Cedar Park, Texas. Oh God, I'm gonna blank on them. Let me see if it comes to me. There's a compounding pharmacy in Cedar Park, Texas. If you were to Google compounding pharmacy, Cedar Park, Texas, methylene blue, you'll find them. Okay, but they have a good product as well too. Those are the 2 that I use.
Okay, thank you so much.
All right. Good luck. Yeah.
Dr.
Hello,
Ross.
Lisa. Oh,
Sorry.
did I just hear somebody else?
Yeah,
Kimberly.
well, Dr. Ross, yes, I have been taking the research nutraceuticals, glutathione and the ATP 360, but I'm taking the glutathione every day.
Yeah.
Is that right? Or am I taking too much?
No, you can do it every day. And specifically, especially if you have tick-borne infections, remember the glutathione is the reparative antioxidant that is used in every one of your cells. And if your cells are under constant assault, or if you have injury to those cells, they're going to use up their glutathione. So it can be useful to just keep taking the stuff through treatment as a means of replenishing your cellular glutathione. In addition, if you are a person that has a lot of problems with excess cytokines and herxing cytokine symptoms, it can be useful at helping to lower those too. So yeah, taking it daily is fine. Even months on end, it's a fine thing to do. Yeah.
Thank you.
Okay. Yeah. All right. Hello, Lisa. Let's see. Good to see you here again. Let's see. You said good to be back here again too. There you go. My daughter recently had a mold urine test and it uncovered high levels of mold in every category. She is 9 months into her Lyme treatment and still very symptomatic. Would you recommend she pause and treat the mold aggressively? Thanks. So what gets tricky here, I'm going to answer it, but let me just give you an overview. All right. So again, the reason that most symptoms that people have when they have tick-borne infections is excess cytokines. Most symptoms that people have when they have mold toxicity is excess cytokines. All right. So they can look a lot alike, right? And typically in my practice, on a first visit with a person, I would try to figure out, based on clinical history, was there a high probability they had mold toxicity or not? Okay. And so what that could look like is, tell me about when you got sick. And they would say, well, I just moved into this new house and we discovered there was black mold growing on the back wall, and that's when I got sick. I mean, that's a no-brainer. I don't care what your Lyme test says, it's mold toxicity based on the history, okay? And so I do have a story. One person that came to see me was a story just like that. He came in, referred by another practitioner in town. He had positive Lyme testing, positive Bartonella testing. Cognitively, he was in bad shape. And the naturopath wanted him to go get IV antibiotics in Washington, D.C. The mother was a nurse, wanted my opinion. And I told him, I said, yeah, it looks like he's got Lyme testing. I'm just not sure that's the cause. Like, test doesn't mean it's the cause, right? And so I said, tell me your story. And basically what it was is he had mold exposure. We spent 6 months not doing anything for the tick-borne infections, 6 months using binders, and he was 100% well. And I never did anything to treat his tick-borne infections. Keep in mind the testing we do, the immunoblots and all that, the antibody testing just says you've been exposed. It doesn't prove the germ is in you. So it's possible maybe his immune system dealt with these on their own. Okay, so the only reason I raise that is it is possible that what your daughter is dealing with now at this point is not tick-borne infection and really is just mold toxicity. Okay, so, but I don't know for sure. So in my practice, I would actually, if I thought that the tick-borne infections, based on my clinical assessment, the tick-borne infections were still there, I would keep doing my tick-borne infection treatments meaning the antimicrobials, while starting binders and using binders. You can do both at the same time, okay? And keep in mind, part of your tick-borne infection management is managing cytokines, so your curcumins, your glutathione, you would keep all that going. And then depending on what the toxins are with a whole spectrum, you could use a broad spectrum binder. So you could do like a mycopole by Research Nutritionals, or you could do a GI detox by Biocide and Botanicals. Both of those are herbal products that have a number of ingredients that will basically hit every mold toxin. Okay. The only thing missing in there is if gliotoxin is high, sometimes bentonite clay will work better if but a good starting place is usually with a broad spectrum binder. You start at 1 a day, and yes, you can do that at the same time that you still can treat germs if there still is a thought that germs are active.
Thank you for all that, Dr. Ross, and it is good to be back here. Can I ask a follow-up question?
Sure.
So her most serious symptoms are gastro symptoms. So she wakes up every morning, nauseous, throws up most days, just throwing up bile. So the thought of adding more things, because she's on the tafenoquine once a week. She's on atovaqone now, 2 pills twice a day because she wasn't getting better, and 500 milligrams of the azithromycin. If you're to think about all those things along with the binder, getting up to 2 or 3 pills a day, is there anything she could back off to allow for the binders?
So quick question, and I'll just ask you directly, and then I'll do specific questions if I need to. But does she have any symptoms that say Babesia to you anymore? Something that screams Babesia?
She still gets hot and cold, she'll get some night sweats. I'm trying to think of some nightmares, still getting nightmares.
Okay. The night. Yeah, so the night sweats still make me wonder about, I can't prove it, but it makes me wonder about Babesia too. All right, so if she's got a lot of nausea, one thing, I don't know if you all have looked at, any of the macrolides, which are basically your erythromycin family of medicines, erythromycins, macrolides, a side effect is nausea.
Yeah.
All right, now, if you've thought about that, keep in mind that if you stop the azithromycin, it can take about 2 weeks before it's completely out of the system.
Okay.
I would, especially if GI nausea, upset is a big part of this for her, I would consider just staying with the tafenoquine for a bit and pulling off the azithromycin for at least 2 weeks and see, does that resolve a lot of the GI symptoms that she's having?
And what about the atovaqone?
The atovaqone can sometimes give nausea too. Don't worry. I may be saying it wrong, but it's a foreign language, believe me.
tomato, I say tomato, right? Yeah.
When I went to medical school, I think one of the first days I was in class, one of the doctors said, "You're about ready to learn a foreign language," and I'm like, "Yeah." It's really true. It's really true. But anyhow, of the three medicines, tafenoquine, atovaqone, azithromycin, the one that I have found that has the greatest chance of giving that upset stomach is going to be your azithromycin. The second one would be the atovaqone. Now, the
Okay.
trick about atovaqone, you may already be doing this, but if you're not doing it already, taking fat at the
Yeah,
same time can ameliorate a lot of that upset. Does she do that?
she does. Yeah.
Okay. I
And
would,
I'm sorry, the gastro symptoms have been plaguing her for years.
yeah.
So it's not, the azithro may be contributing to it. It
Yeah.
most likely is,
Yeah.
but her symptoms definitely predate taking it.
Okay. But if it's worse, I would consider pulling out that azithro.
Okay.
Yeah.
Okay.
That's what I would consider doing. And then the azithro and the tafenoquine can, granted, a stronger Babesia treatment would be to do the triple of azithromycin,
Yeah.
blah, blah, blah. But I have had people move forward, and I have actually gotten rid of Babesia using just atovaqone with tafenoquine before. So that could be an adequate treatment for her as well, too.
Would you consider switching in or substituting in an herbal for the azithromycin? Like a cryptolipid?
You could. You're going to be left with two choices, though. Crypto, which could be a substitute, but crypto is horribly nauseating to people.
Okay.
So
Right. Yeah.
for those of you that use crypto, you know what I'm talking about. It is the most
Okay.
untasty thing in the world. Okay. All right. But the other option would be artemisinin. Now, Dr. Lindner, in his protocol for you treating Babesia, likes to, as a fourth agent, he likes to use artemisinin. So it may, I don't like using artemisinin if I'm treating Babesia microti. I think there's a lot of resistance to artemisinin and Babesia microti on the East Coast. But it is possible what you're looking at with your daughter, because just how complex this has been, is that you're looking more at a Babesia oticoli. And oticoli may be responsive to the artemisinin. So you could try an artemisinin if you wanted to. Yeah.
And one last question. Thank you for all that. Is there I know there's got to be a genetic test, right, that would show whether or not you are a good detoxer versus a not so good detoxer, but is there a blood test? Is there anything in blood work that would point to that? And that's my last question.
The best we have right now is you can get genetic testing, SNP testing, that will look at what your various, they're called CYP enzymes,
Yeah.
profile is for your various CYNP enzymes. All right. So you can get genetic SNP testing done, and there's various companies that have their test. All right. The trouble is, at this point, though, is, having a genetic profile does not mean you manifest the problem.
Right.
So there's our genetic map, and then there's the interpretation of the genetic map. We call that epigenetics, okay? And it's the interpretation and what the body does to use this or not use this, and then what that comes out, the products of this epigenetic interpretation, is the better way to go. But we have not developed the test yet for most of these. It's a whole area called metabolomics. There's a whole area they call it the omics. Okay, you may have seen that. What omics is doing is it's two steps removed from the genetics and the epigenetics. It's at looking at what gets produced. And at this point, we don't have good tests for detoxing on that. So I tend not to be a genetic tester. You will find people that will argue for it, I admit, but that doesn't tell me what's going on in terms of what happens in the epigenetic dealing with the genes, basically. I have no idea what goes on there.
Thank you.
All right.
Thanks so much.
You're welcome. Good luck to your daughter.
Thank you.
Does anyone else have a comment there about this?
I do.
Yeah.
What is the safest dose of binder to take it? I mean, I know we're all different, but like the GI detox or mycopole. Thank you.
What I like to do, where I start with anyone, well, let me put it this way. If I've got somebody that is extremely sensitive, I know they react to everything. I know they've had strong Herxheimer reactions, that kind of a person, right? I might start at a half a pill. In other words, I'll have them open up the capsule and take half. And I might even have them start at half every other day. Okay. All right. But for most people, where I like to start is at one pill a day, one time a day. And if they can tolerate it, I eventually like to get them up to 2 pills, either as 2 pills one time a day or 1 pill twice a day. All right. Now, I have gotten all kinds of people well just doing 1 pill of a GI detox or a myco pill one time a day. I've gotten plenty of people well doing that. All right. But sometimes people do better. You can get them up to 1 pill twice a day or 2 pills one time a day. Keep in mind with any of your binders, they bind things, right? So you want to make sure that you're stopping your prescriptions and herbs at least an hour before you take your binder. And then you can resume those again 2 hours after your binder. Eating food, you can do any time in there, but the ideal time would be to have a small snack about half an hour after you take your binder. And the reason is whenever you eat, it causes your gallbladder to contract and squeeze its contents out. The gallbladder is where a lot of these toxins get stored. And basically, if you eat something a half hour after you take your GI detox, for instance, that gives it enough time to work its way into the area of the small intestines where the gallbladder releases its stuff out. Okay, so that's just the timing issue is no medicines or supplements half an hour before. I'm sorry, half an hour before. Let me rephrase it. 30 minutes before you want to stop everything, not an hour. It makes it easier. Okay, so 30 minutes before, stop everything and resume them 2 hours later. Food, the ideal time would be to have something, anything, a small bite, about a half an hour after you have your binder. Okay?
Awesome. Thank you. That was really helpful.
You're welcome. All right. All right, let's see here. Let me move on. Oh, let's see, get rid of that. Hello, Sally. Let's see, I have chronic chapped lips for decades. Do you know what causes this? Also, with bilateral chronic hip pain, is this caused by Borrelia, Bart, or Babesia? And does Babesia cause crying, sobbing? And LMD told me this. All right, so in terms of when I tend to think of more emotionality, crying, etc., I'm tending to think more Bartonella than Babesia. Could Babesia give you some psych symptoms? Yes, but it's lower down on my list. And so I would usually say more Bartonella is what I would think. Okay, just so you know. All right. In terms of chronic hip pain, one thing to make sure that you have looked at with your doctors, and this could be your non-LLMD doctor, is to get evaluated for hip osteoarthritis, which is wearing down of the cartilage in your hip joint. And when you wear down cartilage in your hip joint, you get bone rubbing on bone, which can give you this kind of pain. It is possible that tick-borne infections, due to the inflammation they produce, may lead to a more rapid wearing down of cartilage in your joints. Okay. But the way to find out for sure if you have osteoarthritis is you need x-ray imaging. And there's different changes they can see on x-ray that indicate whether you've lost some of your cartilage levels and whether you're getting inflammation within the bones. All right. And now there's different degrees, right? So if your doctors say you've got it, but it still looks like you've got some cartilage, if you still have some cartilage, what I'm really like these days is there's a new product that got released that's been available in India for a long time, but is now recently available here in the States called Cardigenics, which is a combination of celery seed and boswellia. And the 3 studies that have been done on that product, and these were actually, one of them, I believe, was a double-blinded study. It was high quality, show increase markers of cartilage production. In addition, it shows thickening of the cartilage with increased distance between the bones on follow-up x-rays and marked reduction in the various inflammatory markers that you see too. So that's something for you to consider. I will show you a whole article I have here in a minute. I just released, I think a week ago, on how to deal with osteoarthritis and joint pain. But if it is that your doctors look at you and say osteoarthritis, think about looking at this product called Cardigenics, based on the studies that show what I just said: decreased inflammation, increased cartilage production as well too. Okay, all right. So Sally, did that answer your question for you? Let me, I'm not sure if Sally's still here or not. I'm going to do a quick screen share to show you guys all this. All right, so let's just say pain. Actually, I know where I put it. Yeah, let me get rid of this. It's, oh, maybe I didn't put it there. Oh, I put it here. All right, this is the newest article that I have on how to manage joint pain. And in here, I talk about this celery product, okay? And in terms of the celery seed product, it's this product right here, all right? So take a look at that. And actually, the studies are very impressive on this one. So not all supplements have good quality studies behind them, but these are some pretty good studies here, all right? Okay, let's see, get out of that. There we go, all right. All right, good luck to you, Sally. All right.
Dr. Ross, I got a follow-up question to that.
Yeah.
So collagen powder, when we're talking about, cartilage and all that, is collagen powder something you would recommend, or?
Yeah. It depends on the collagen powder. So there's type 1 collagen is what is found in cartilage. And there's mixed studies on that. When I was preparing that article, I actually did get into looking at a lot of studies. I know I believe the American Rheumatologic Association actually recommends it. One of the societies does, but when you really get into science, it can go either way. So my son, I think I would try it. I'm not convinced it's going to be a great thing. It's kind of like the science on glucosamine and chondroitin sulfate. There is limited science showing that the chondroitin may increase cartilage thickness, but when you look at a broad swath of studies that have been done looking at both glucosamine and chondroitin, generally it comes out a complete wash as to whether it does something or not. So it's one of those things you could try. I would not give it high probability, basically.
Got it. Thank you.
Yeah. All right. Hello, Jacqueline. Let's see. Platelet-rich plasma therapy is a medical treatment that uses concentration of patient's own platelets to promote healing. I recently attended a Q&A with some Lyme later doctors who are now recommending this for their patients. Can you please discuss the risk benefits and diagnose? Okay, yeah. So there is platelet-rich plasma is something that I discussed specifically in that joint pain article that I just showed you. And for joint pain, there are clear studies that show that if you inject platelet, so let's talk about so platelet-rich plasma is basically if somebody draws your blood and they centrifuge it and they collect a concentrated version of your platelets, all right? And the studies that have been done looking at it are mainly for joint issues, not for managing Lyme, not for managing the immune system, and all these things that this company called True Dose is claiming. But the science really exists around the joints. That's it, okay? And what the joint science shows is that you do get decreased inflammation. So in platelet-rich plasma, there are immune system modulators. And there are various growth factors, especially growth factors that may promote the growth of cartilage. All right. So in studies on osteoarthritis, it is clear the studies do support increased joint mobility and decreased joint pain when you do platelet-rich plasma injections, and a recommended frequency is usually about every year or every 6 months. Okay. The studies, though, looking at do you get generated cartilage, even though there's all these growth factors in these platelets, the studies are mixed. Some of them say yes, some of them say no. Part of the problem in interpreting studies on joint health is that there has been no standardization as to how the platelets are prepared and the concentration of those platelets in studies. And some of the studies suggest a higher concentration is going to give you more benefits. Okay. All right. Then you now have this company called TrueDose that has supposedly standardized platelet collection and the amount you should get based on some computer algorithm about what is trying to be treated. All right. And I'm skeptical. The reason I'm skeptical is in just looking at the science that is there around joint health, it's not that great. I mean, there's just not enough. And I don't think anyone has truly studied this to show you what happens in trying to inject it into your bloodstream to somehow turn the immune system on to help with Lyme. And that's what they're basically claiming it can do. I do think PRP injections are probably valid if you're trying to inject it into a joint, because as I said, there are studies that show improved mobility and decreased pain. I am skeptical, and regrettably, we see this in the world of Lyme. People are desperate, and there's people that come up with these treatments that do not have scientific backing, like SOT has basically no scientific backing, and yet people are doing that. Years ago, it used to be everyone was going to get their stem cell injections, okay? And there was a phase where the craze was, I'm going to get my stem cells and I'm going to recover. In the end, what studies tell us about that novel therapy is that, and this is based on my Lyme data, which is part of LymeDisease.org, a number of years ago, about 3 or 4 years ago, went out and asked people what happened when they did various alternatives. Did they have side effects and did they get better? And in the end, even though there was this craze, just like the craze for SOT, and I suspect there's going to be this craze now for this TrueDose platelets, is in the end, only 3% of people who threw their money away reported benefit. Okay. So I want everyone to be careful. There is no magic bullet. I'm extremely skeptical because no one's done science looking at, does TrueDose PRP work for Lyme? I just don't think it exists. All right. And when you hear of new treatments, there will be people that say it works, like an SOT, but keep in mind, any drug that has been approved by the FDA, when they do controlled studies or they give somebody a placebo, 30% of those people that get the placebo report benefits. All right. So there is healing reactions. There are placebo healing reactions, which I think are great. But in the case of SOT, do you want to pay $5,000 for your healing reaction? I mean, it's my commentary there. Okay. So be careful. There's a lot of people out there that want to take your money and doing things that really don't have foundation or adequate foundation under them. And I think other than using PRP for joints, I don't think that there's adequate science there. That's my impression right now, at least. Okay. All right. Cindy, I see your hand up there. Cindy, are you still here? Nope. All right. All right. Lisa, I see your hand up there.
Just a quick, I'll just pass this along, something I learned in Lyme United.
Yeah.
There was a medical doctor who participated in Lyme United, and I had asked the question in our group thread, and she said that in Connecticut, where it was used for a while, it did not, in most patients, it did not work. And in 2 that she can remember, it actually made things worse. So I'm just passing that along.
Is the PRP or SOT?
The TrueDose. I'm sorry. The
Okay.
TrueDose, not the PRP into a joint. I had that and it gave me 2 more 2 more years on a bum hip. So,
Yeah.
but a true dose for Lyme.
Yeah, I'm skeptical. Thank you for sharing that.
Yeah.
Thank you. Yeah. Leslie, I see your hand up. All right. Cindy, I still see your hand up too, but do either Leslie or Cindy, are either one of you still here?
Yeah, I think I'm having speaker problems.
Oh, there
Can
you are. I hear you now.
Okay. Yeah, I just wanted to comment. I had PRP done 2 years ago this month.
Yeah.
It did not work. It cost me $3,500 out of pocket, which was a waste of, actually, I felt worse after I had it. And I would like to say that most insurance companies do not cover it. It's considered investigational because it just hasn't been proven to be
It's true.
effective, as you said.
Yeah.
I wish I would not have had it.
Well, thank you for sharing that. I appreciate it.
Yeah.
Was that Cindy talking or was that Leslie talking?
No, it was Cindy. It's
okay.
Cindy.
All right. All right. Got it. All right.
I
Leslie.
think I'm having audio issues.
Okay. And then Leslie, do you have a comment?
Yeah, can you hear me?
Yeah, I can hear you now.
Oh, okay. This is my first time. So first,
Welcome here.
I'd like to really thank you because I feel like I got a flood of information from you.
you got one of my ask me one question, I'll tell you 20 things session. So yeah.
My basic question is just I had Lyme disease acute phase 2 years ago, and I still have a lot of neurological symptoms. My balance is miserable. I'm getting a little bit back in terms of not being quite so brain foggy.
Yeah.
But my balance, dizziness, vertigo, horrible electrical hypersensitivity.
Yeah.
Do you have any recommendations? And
yeah. So we're kind of at the end of the webinar here, and to come up with a thorough answer, I would need to ask you a bunch of questions. But so when you have one of the big reasons that people tend to have a hard time recovering from tick-borne illnesses, there's a number of reasons, but one is if they have a co-infection or other tick-borne infection that got missed that somebody has not been treating for. Okay. So when you get Lyme, based on tick studies out, I think New Jersey, maybe in Connecticut or New Jersey, one of the two, out there, 75% of ticks that transmit Lyme also carry one other tick-borne infection, and 60% carry 2 other tick-borne infections. So what that tells us is that many people are multiply infected with different germs. So when I have the story of somebody who says they've been treated for Lyme and they're not getting better, and they have a lot of what I would call neurologic symptoms, which is what you're describing, the thing I always wonder about is Bartonella. Bartonella can give you a lot of neurologic symptoms. So the key thing is that Bartonella gives you neurologic. It can give you a lot of psychiatric, and a common psychiatric would be just persistently anxious. It's like you feel like you're coming out of your skin and you don't know why. Sometimes bad depression can go with that too. Bartonella sometimes can give you air hunger, a feeling like you can't get enough air from time to time. Bartonella can give a lot of pain on the soles of the feet in some people, not everyone. And then Bartonella can sometimes give you a rash that looks like stretch marks in areas that you would not expect to see stretch marks. So if you have a number of those things, and if you've been treated for Borrelia, but your neurologic is not getting better, it may be that there is Bartonella in there as well too. And so if you are working with a provider, I would ask them, can you help me figure out if I've got Bartonella going on here? Okay.
Okay, thank you so much, because all those symptoms just like hit the bell. But
let me just
for it.
So let me just show you. I'll do a quick screen share here for you too. So there's some things you can look at on your own here too. So take a look in my Lymology guides and look in this how to diagnose section.
Okay.
And then take a look at this article on how to diagnose Bartonella and chronic Lyme disease. Okay. And in here, I make the case that because testing isn't perfect, you can make a diagnosis based on symptoms. All right. So read through here. I go through the symptoms, I think down in this section here, but you can make a diagnosis based on symptoms. All right. So take a look there. And then if you're wondering how would you go if you have it and you're wondering how do you design a treatment for it or management of it, take a look at this article called The Ultimate Bartonella Management Guide. And in here, I go through both herbal and prescriptive ways of approaching Bartonella. Okay.
Thank you so much.
Yeah. Good luck to you. All right. All right, everyone. It's been a good night. I've enjoyed being back here with you again. I feel I got more energized the longer I talked with you all tonight. So that's good on the heels of having had COVID here recently. So I plan on being back here with everyone again next week. And so in the email tomorrow morning, there will be a link that you can sign up for next week's Zoom meeting as well. And again, my hope is to get that email out to you somewhere between before 9:30 or 10 Central Standard Time, Austin, Texas time tomorrow. Okay. All right. Good night, everyone.
Thank you.
You're welcome.
Thank you.
Yeah.